Buying medicine at a pharmacy. Hello everyone. Welcome to English Listening Time. Today we're going to dive deep into the topic of buying medicine at a pharmacy. This is an essential skill that everyone should have, especially when traveling or living in an English-speaking country. We'll cover everything from basic vocabulary to common phrases, and even some cultural aspects of visiting a pharmacy. So let's get started. First, let's talk about what a pharmacy is and why it's important. A pharmacy, also known as a drugstore in some countries, is a place where you can buy medicines, health-related products, and sometimes personal care items. Pharmacies play a crucial role in our healthcare system. They're not just shops. They're places where you can get professional advice about your health and medications. When you approach a pharmacy, you'll usually see a green cross sign outside. This is a universal symbol for pharmacies in many countries. It makes them easy to spot, even if you're in a foreign place. The green color is often associated with health and well-being. Now let's step inside a typical pharmacy. What do you see? You'll probably notice several distinct areas. One over-the-counter medicine area. This is where you can find medicines that don't require a prescription. These might include pain relievers, cold and flu remedies, and allergy medications. 2. Prescription counter. This is where pharmacists work. If you have a prescription from your doctor, this is where you'll go to get it filled. 3. Personal care section. Here you'll find items like shampoo, toothpaste, skincare products, and other toiletries. 4. First aid section. This area contains items for treating minor injuries, such as bandages, antiseptic creams, and ice packs. 5. Vitamin and supplement section. Here you can find various vitamins, minerals, and dietary supplements. Let's focus on the people you might meet in a pharmacy. The most important person is the pharmacist. Pharmacists are highly trained healthcare professionals. They don't just sell medicine. They can give you advice about how to take your medicine correctly, potential side effects of medications, interactions between different medicines, general health advice for minor ailments. In many countries, pharmacists undergo years of specialized education and training. They're a valuable resource, so don't hesitate to ask them questions. You might also encounter pharmacy technicians. They assist the pharmacist and may help you find products or ring up your purchases. Now let's imagine you're not feeling well and need to visit a pharmacy. What should you do? Here's a step-by-step guide. 1. Assess your symptoms. Before you go to the pharmacy, think about how you're feeling. Are you experiencing pain? Do you have a fever? Is your nose running? The more clearly you can describe your symptoms, the better the pharmacist can help you. 2. Enter the pharmacy. When you walk in, take a moment to orient yourself. Look for signs that might direct you to the right section. 3. Ask for help. If you can't find what you need, don't hesitate to ask for assistance. You can say something like, "Excuse me, could you help me find something for a headache?" 4. Describe your symptoms. When talking to the pharmacist or staff, be as clear and specific as possible about how you're feeling. For example, "I've had a throbbing pain in my temples since yesterday afternoon." 5. Listen to recommendations. The pharmacist might suggest a particular medicine or even recommend that you see a doctor if your symptoms sound serious. 6. Read labels carefully. Before you buy any medicine, read the label. Pay attention to the active ingredients, dosage instructions, and any warnings. 7. Ask questions. If you're unsure about anything, ask. It's better to be clear than to take medicine incorrectly. 8. Make your purchase. Once you've decided what to buy, take your items to the counter to pay. Now let's expand our vocabulary related to health and pharmacies. We'll start with common health problems. 1. Headache. Pain in your head. There are different types like tension headaches or migraines. 2. Cold. A viral infection that affects your nose and throat. Symptoms include a runny nose, sore throat, and cough. 3. Flu. Similar to a cold but usually more severe. It often includes fever, body aches, and fatigue. 4. Allergies. When your body reacts to substances like pollen, dust, or certain foods. Symptoms can include sneezing, itchy eyes, and rashes. 5. Indigestion. Discomfort in your upper abdomen, often after eating. It might feel like burning or bloating. 6. Constipation. Difficulty passing stools or infrequent bowel movements. 7. Diarrhea. Loose, watery stools occurring more frequently than usual. 8. Insomnia. Difficulty falling asleep or staying asleep. 9. Anxiety. Feelings of worry, nervousness, or unease. 10. Depression. Persistent feelings of sadness and loss of interest in activities. Next, let's look at some common types of medication you might encounter. 1. Analgesics. These are pain relievers. Common ones include paracetamol, also known as acetaminophen, and ibuprofen. 2. Antihistamines. These help with allergy symptoms. 3. Decongestants. These help relieve nasal congestion. 4. Antacids. These help with indigestion and heartburn. 5. Laxatives. These help relieve constipation. 6. Antidiarrheal medicines. These help stop diarrhea. 7. Antiemetics. These help prevent or stop nausea and vomiting. 8. Cough suppressants. These help reduce coughing. 9. Expectorants. These help loosen mucus in your lungs so you can cough it up. 10. Topical creams. These are applied to the skin for various conditions like rashes or muscle pain. Now let's dive deeper into some important concepts related to medication. 1. Prescription versus over-the-counter, OTC medicines. Prescription medicines can only be obtained with a doctor's prescription. They're usually stronger and are used to treat more serious conditions. Over-the-counter medicines can be bought without a prescription. They're for treating minor ailments and are considered safe for general use when taken as directed. 2. Generic versus brand name medicines. Brand name medicines are the original products developed by pharmaceutical companies. Generic medicines have the same active ingredients as brand name medicines, but are usually cheaper. 3. Dosage. This refers to how much medicine you should take and how often. Always follow the dosage instructions carefully. 4. Side effects. These are unwanted effects that a medicine might cause in addition to its intended effect. Common side effects might include drowsiness, nausea, or dry mouth. 5. Drug interactions. This is when one medicine affects how another medicine works in your body. Always tell your pharmacist about all the medicines you're taking, including supplements and herbal remedies. 6. Expiration date. This is the date after which the medicine may not be as effective or safe to use. Always check the expiration date before taking any medicine. Now let's practice some useful phrases you might use or hear in a pharmacy. 1. I'm not feeling well. Can you recommend something for? 2. What are the side effects of this medicine? 3. How often should I take this? 4. Is this safe to take with? Mention any other medicines you're taking. 5. Do you have a generic version of this medicine? 6. Could you explain how to use this, please? 7. Is there a non-drowsy option? 8. Do I need a prescription for this? 9. How long should I take this for? 10. What should I do if I miss a dose? Remember, pharmacists are there to help you. Don't be shy about asking questions or asking them to repeat something if you didn't understand. Let's now talk about some cultural aspects of visiting a pharmacy in English-speaking countries. 1. Privacy. In many countries, pharmacies have a private consultation area where you can speak to the pharmacist confidentially about your health concerns. 2. Insurance. In some countries like the United States, your health insurance might cover part of the cost of your prescription medicines. You might hear phrases like, "Do you have insurance?" or "Please provide your insurance card." 3. Identification. For certain medicines, especially prescription drugs, you might be asked to show identification. This is to ensure the safety and proper use of the medication. 4. Refills. If you have a long-term prescription, you might be able to get refills without seeing your doctor each time. You might hear, "Do you need a refill?" or "How many refills do you have left?" 5. Disposal of old medicines. Many pharmacies offer services to safely dispose of expired or unused medications. This is important for both safety and environmental reasons. Now, let's have an extended conversation that might occur in a pharmacy. This will help you practice what you've learned. Pharmacist. Good morning. Welcome to City Pharmacy. How can I assist you today? Customer. Good morning. I'm not feeling very well. I think I might have a cold. Pharmacist. I'm sorry to hear that. Can you tell me more about your symptoms? Customer. Well, I've had a runny nose and a sore throat since yesterday. I'm also feeling quite tired and I think I might have a slight fever. Pharmacist. I see. Have you taken your temperature? Customer: No, I haven't. I don't have a thermometer at home. Pharmacist: Okay, no problem. We have thermometers available if you'd like to purchase one. It's always good to have at home. Based on your symptoms, it does sound like you might have a cold. Have you taken any medication for it yet? Customer: Oh, I haven't. That's why I came here. I'm not sure what to take. Pharmacist: All right, I can certainly help you with that. For your symptoms, I would recommend a combination of treatments. First, for the sore throat, you might want to try these lozenges. They can help soothe the pain and reduce inflammation. Customer: Okay, that sounds good. Pharmacist: For the runny nose and other cold symptoms, this over-the-counter cold medicine could be helpful. It contains a decongestant to help with the runny nose and an analgesic to help if you have any aches or fever. Customer: Is it safe? I mean, are there any side effects I should know about? Pharmacist: Good question. The most common side effects are drowsiness and dry mouth. If you need to drive or operate machinery, you might want to choose the non-drowsy version. Also, are you currently taking any other medications? Customer: No, I'm not. Pharmacist: Okay, then this should be fine for you. Just make sure to follow the dosage instructions on the package. Don't take more than the recommended amount. Customer: Got it. How often should I take it? Pharmacist: For this particular medicine, you should take 1 tablet every 4 to 6 hours, but no more than 4 tablets in 24 hours. And make sure you're drinking plenty of water too. Customer: All right, I'll remember that. Is there anything else you'd recommend? Pharmacist: Yes, actually. It's always good to boost your vitamin C intake when you have a cold. We have some effervescent vitamin C tablets that you can dissolve in water. They can help support your immune system. Customer: That sounds like a good idea. I'll take those too. Pharmacist: Excellent. Oh, and one more thing. Rest is very important when you're fighting a cold. Try to get plenty of sleep and don't push yourself too hard. Customer: Thank you, I'll try to take it easy. Pharmacist: Is there anything else you need today? Customer: Oh, I think that's everything. Oh, actually, could you remind me how to take the vitamin C? Pharmacist: Of course. You should dissolve 1 tablet in a glass of water once a day. It's best to take it with a meal. Customer: Perfect, thank you. You've been very helpful. Pharmacist: You're welcome. That'll be $28.50 in total. How would you like to pay? Customer: I'll pay by credit card, please. Pharmacist: Sure, here's the card machine. Just insert your card and follow the instructions on the screen. Customer: Okay, done. Pharmacist: Great, here's your receipt. Is there anything else I can help you with? Customer: No, that's all. Thank you very much for your help. Pharmacist: You're welcome. I hope you feel better soon. If your symptoms don't improve in a few days, or if they get worse, please don't hesitate to come back or consult a doctor. Customer: I will thank you. Goodbye. Pharmacist: Goodbye. Take care. This conversation demonstrates many of the phrases and concepts we've discussed. It shows how a pharmacist can provide valuable advice and how you, as a customer, can ask important questions about your health and medication. Now, let's review some key points to remember when buying medicine at a pharmacy. 1. Be prepared to describe your symptoms clearly. 2. Don't be afraid to ask questions about the medicine, its effects, and how to take it. 3. Always read the label and follow the dosage instructions carefully. 4. Inform the pharmacist about any other medications you're taking. 5. If you don't understand something, ask for clarification. 6. Keep your receipt in case you need to return anything or for insurance purposes. 7. If your symptoms persist or worsen, seek further medical advice. Learning about health and medicine in English is not just about expanding your vocabulary. It's about being able to take care of yourself and communicate effectively about your health needs, which is crucial when living in or visiting an English-speaking country. Here are some additional exercises you can do to practice what you've learned. 1. Create a list of your current medications, if any, in English, including the dosage and frequency. 2. Practice pronouncing the names of common medicines and health conditions. 3. Write a dialogue between a pharmacist and a customer for a different health problem. 4. Try to read and understand the label on an over-the-counter medicine. 5. Research common health idioms in English, like under the weather, feeling ill. Or fit as a fiddle, very healthy. Remember, learning a language is a journey, not a destination. Every time you practice, you're making progress. Don't be discouraged if you find some health-related terms difficult at first. With time and practice, they'll become more familiar. In many English-speaking countries, pharmacies are expanding their services. Some now offer 1 flu shots and other vaccinations, 2 blood pressure checks, 3 diabetes screening, 4 smoking cessation programs, 5 medication review services. These services can vary by country and even by individual pharmacy, but they show how pharmacies are becoming more involved in overall health management. When traveling to an English-speaking country, it's a good idea to learn the generic names of any medications you take regularly. Brand names can vary between countries, but generic names are usually the same. Also, be aware that some medicines that are available over the counter in your home country might require a prescription in other countries, and vice versa. If you're traveling with prescription medication, it's a good idea to bring a copy of the prescription and a doctor's note, especially if it's a controlled substance. Lastly, let's talk about the importance of medication safety. 1. Always store medicines out of reach of children. 2. Keep medicines in their original containers so you don't confuse them. 3. Never share prescription medicines with others, even if they have the same condition. 4. Check the expiration dates on your medicines regularly and dispose of any that are out of date. 5. If you have any allergies, always check the ingredients list before taking a new medicine. 6. If you experience any unexpected side effects, contact your pharmacist or doctor immediately. Learning about health and pharmacies in English is an ongoing process. Medical science is always advancing, and new treatments are constantly being developed. Stay curious, keep learning, and don't be afraid to ask questions when it comes to your health. We hope this extended lesson about buying medicine at a pharmacy has been informative and helpful. Understanding how to take care of your health in English is a valuable skill that can serve you well in many situations. Thank you for joining us today on English Listening Time. We've covered a lot of ground, from basic pharmacy vocabulary to complex health concepts. Remember, the key to learning is practice and patience. Keep listening, keep speaking, and keep learning. In our future lessons, we'll explore other everyday situations where English can be useful. Until then, stay healthy and happy learning.